So to set this up, in the summer of 2019, I had a growing pain and infection in my neck. I tried going around different hospitals and doctors' offices to get a scan and a diagnosis for this injury. And basically, it was I have a broken skull. It was leaking CSF fluid into this wound that had not been able to heal properly or receive a proper diagnosis or treatment in about a year's time. And on May 30th, I went to AFC Parkway Birmingham, Alabama. That's American Family Care. I had a basic standard x-ray. And on this x-ray, this x-ray, it was analyzed as not showing any type of acute finding or abnormality, basically. But on the image, you can see a cloudy, a translucent oval that appears near this injury area that I had. So on August 3rd, I made it to St. Vincent's East Hospital, Birmingham, Alabama, Emergency Department. I had a lot of pain in the area of my neck on the left side. And the symptoms of infection were growing. The main thing that drove me to the hospital was the pain in my neck. It would swell regularly in the evenings. It would swell up. It was red hot. My skin, it would become hot like fire. But I would take my temperature, and I had a normal temperature. And I have no idea what had caused this. I would wake up at night. I had chills and shakes. Something was like out of whack, seriously. So let's see. On August 3rd, I made it to St. Vincent's East Hospital. They did a CT, computed tomography scan with contrast. Looked at the area, the soft tissue of the neck. This was a cervical scan. The scan, the images that came out of this, they had two doctors, radiologists, look at this time. It was Navid Zenooz and Donald Shane Kelly, MD. Both noted more or less no acute finding. The images from this scan, the brightness and the contrast were manipulated in such a way so you can't really see that I had a broken skull. On the other CT scan I had done without contrast, you can see there's a clear bone broken in the area of the occipital condyle condylar canal on the underside of my skull. So on the August 3rd, 2019 scan, the main thing that's obvious is in this area where I had pain, and this is what had driven me to the emergency room in the first place, you can see below the area of the wound, which is misdiagnosed, undiagnosed at this point, you can see there appears to be some type of insect. Has a head, has a abdomen, thorax, has wings. It appears to be a fly, a large fly, maybe a Botfly, a Wulf. It resembles like a cockroach or a fly. I think most people know what that kind of an insect looks like. And you go through these images and you can see that there's a very clear flying insect in my neck in the CT images. And then there appears to be a couple of different parasites developing in this area. And it appears to be, like 3 inches long. That's the length that I've guesstimated here. You can only get parasites like that develop, in your neck. Generally speaking, they got to have a food source. But yeah, the pain was horrible. I could hear it making noise. I'd lay in bed, I could hear squeaking, squealing, chirping. Whatever was in this area, it made noise. And it was a horrible experience. Really sad. Doctors in this hospital, Ascension Health, they missed this 3-inch long parasite completely. Did not acknowledge it in their report. I asked a doctor there in the emergency room, Mr. Jones, if I could. They officially diagnosed me with leukocytosis, and he told me that it may be some type of infection. I asked for antibiotics. I requested antibiotics to treat this. And I was told by him that they would have to do more tests to determine which antibiotics I needed. They weren't willing to do those tests. Although, I had this obvious parasite in these images that they didn't see, by the way. I had to find this later on. I went to the hospital, got my records, images on the CD, paper records. I went through this stuff, and I found out later on, what this stuff actually was. They didn't see this when I went there for my visit. So about 2 weeks later, I went to Northside Medical Associates, St. Vincent's Primary Care, located off of Deerfoot Parkway, Happy Hollow Road, Trussville, Alabama. And had a MRI done in this building. And in this scan, you can also see this scan. It was done a few days after I had started antibiotic treatment, amoxicillin, and you can see some of the effects of the antibiotics on this area. In the MRI, you can see there's a massive infection. Expanded out to my ear, is in my jaw. They acknowledged this in this place as a mastoiditis, but yeah, it was far worse than that. And you can see in this area where this parasite was located in the CT from a few weeks earlier, there's a round black abnormality